So our first guest is a doctor that helps out a lot of women. I guess a lot of men. We'll find out tonight. She helps them with their goals, what they want to reach. Some of them have their New Year 2021 goals. Some have goals before. Some people want to have different changes. They wasn't feeling good about themselves. So I love that the work that she does. She's a good person. Her name is Dr. Bartholomew, but we call her Dr. B. So Jamie, can you bring in Dr. B?
Hi guys, how are you?
Hey, Dr. B, how you
Hey,
doing?
Dr. B. How you doing?
How you doing? Okay.
Good seeing you again, Dr. B.
Same here.
Dr. B, can you tell people a little bit about yourself so that people understand who you are and your credentials and stuff like that?
Sure, not a problem. So my name is Dr. Djenane Bartholomew. I have a I have a doctoral in nurse practice. I've was a registered nurse for 15 years, went back to school to get my doctoral degree in nursing. And from there, I started, thinking about something. I wanted something different. I wanted, after labor and delivery, home health, I wanted something different. And I myself had some surgeries and had some enhancements, I should say, not surgeries, some enhancements. And from there, I fell in love with aesthetics. And that's how I decided to pursue my inspiration in aesthetics, and went back to a spa that provided me the post-op care there, and just fell in love with it from just being there as a client, and went back. And since then, it's been 4 years now, and I've been there, and I just love it. It's different, and it's exciting. Every day, you leave with joy, being able to help another woman reach their goals.
That's good. And I understand that feeling. Let me ask you a question, though. Dr. B, it's 4 men on the show. We're joking. Do you have men clientele? And what do men come in pretty much for?
Yeah, I do. I have male clientels. Obviously, they don't like to tell one another. Okay. But they do come in. They come in for Botox. They come in for fillers. They come in for the P-shot.
What's the whoa. Dr. B, you can't sneak in a P. What's a P-shot?
Slid that in.
What's a P-shot? I know, I'm serious. What is a P-shot? I got this. What's a P-shot?
So the P-shot is basically some men. It's basically, we take the blood and we spin it, and we inject the platelets-rich plasma back down there, in order to help with getting it working again.
Oh, to get it up, not to make an extension on it.
Not to make an extension.
Okay. Because you was about to get a lot of money, because a lot of guys are walking around with strip dick. You was about to get a lot of money out here, Dr. B. So you got 27,000 viewers in the Latin country. You had a whole bunch of people flying over here, risking it all to get the extension on there. You know what I'm saying? So, wow. Sorry, guys.
So let me ask you this question. What is a consultation like? And I always wonder, because I'm assuming when you make this step, you probably are able to tell somebody what they think it's going to look like, whatever they have done. But once it's done, it's done. And so I'm assuming, from nose jobs to just, certain things that people would do commonly. What is it like? Are you ever in a situation where you could tell someone is on the fence, and you may say, you're not ready for this step yet?
So what we do is non-invasive. Everything is non-invasive. So, with fillers, you can dissolve them if they're not happy with it. However, there are certain things as far as that you can't just reverse. But what we do is that when I sit down with a client, I want to understand what their goal, what bothers them the most, right? Because that's how we know what they need to address. Because sometimes it's just that a lot of clients are coming in and saying, I want to look like this, and they want to show you something on Instagram, and that's not necessarily. You got to take them back and explain to them that that's not necessarily how this person looks.
Yeah.
It's makeup, there's filter.
Yeah.
So, and we have to get them to understand that you want to look like you. You just want a better version of you, not necessarily want to look like this person, because no one looks alike. That's why we're different. So by the time we have this conversation, and we most times what the wishes that they're coming in for, they realize some of them that yes, we can. And if we can't help you, we tell you, straightforward that we can't help you because we're all about giving you results. We're not about with as far as giving you false, because if you have someone that comes in and wants to lose weight and they want to do something that that's not going to really achieve that it's really that you have to go the surgical route, we then will recommend and give you a couple of doctors that you can go surgical coordinators to go take that path down, go down that path.
So let me ask you a question. Like I have a few homegirls that got the fat transferred to the butt part of that. Now, what goes into all of that? Like after you get do you have to gain a certain amount of weight to get the fat transferred to that part? And then what's the recovery and all that stuff? And what do like massages, anything like that they have to do?
Yeah, so that's surgical. So when they come in and we see them pre-op as far as if they have their hemoglobin is low, we offer IV drips in order to get them ready for the surgery. Then we see them post-op with my partner Plasti Munekis on Sunset Park, where different modalities help as far as helping them recover. Because a lot of people, they know just about the surgery. They get the money up for the surgery, but they don't understand that post-op is just as important as having your surgery. And you see it. You see people that had the surgery and did not follow post-op massages or did not do any kind of follow-up after, just had their healing process is different. They develop certain things that, that could have been prevented. And slowly and surely, most of the doctors are seeing that, and they are encouraging their clients in order to get post-op.
Got you. Any questions?
I got one, Dr. B. Dr. B, do you find that most of your clients that come in there, they're getting procedures done mostly for themselves, or they get procedures done based on things that they see on the internet or for significant others?
I want to say at least 50% are getting it for themselves. They're ready to make that change. They're ready, whether they're coming out of a relationship, whether they're reaching a milestone of an age, that they're really, they're ready to commit to change stuff about for themselves.
So do you feel like the social media influences a lot of people's decisions?
Absolutely. I do think that, because you're seeing that on the social media, Instagram, they're seeing the bodies. So of course that also creates the interest. And then they're understanding that there's many avenues, because prior to that, a lot of people was, whether they were traveling, overseas, now they're going state to state. So they're looking at different doctors' work and understanding what it is that what is their desired goal.
So speaking of what you just said, of going across seas, what's the difference and what's the pros and cons you think of people that are going to DR, Colombia, or Brazil? When we saw recently, like Usher Raymond's mother passed away, I think. No, Kanye West, Kanye West and Usher's Raymond's wife and stuff like that. And I had a family member and a few other people I know that went to DR and things didn't go right. So what are the pros and cons of that?
Personally,
and why do people go? Why do people go to
I
a
would
country?
say that how I had one of my surgeries overseas. So I went to DR. And I think that how it's what you want. You have to research the doctor, whether they be in US or overseas, you have to do your research. What I find that how, for me, is that how the New York doctors are great. However, the contouring, the body that, that especially, us African American are desiring to have, that I find that how, it's not somewhat, the overseas have more, that they're more advanced with that. As far as that, not to say that some of the doctors up here are they're great doctors, but for me personally, when I was doing my research, I wanted the curves. I wanted something that I was going to be, happy with. And as I was researching, now you have to say Miami is Florida is these doctors are in Florida now, But prior to that, it wasn't so common. It was common of going overseas to do it. And I still think that how overseas, you're not I guess the regulations a little bit more, because there's a certain amount of fat they can take from you up here.
Well, I got enough fat to share for everybody. So if you want to borrow some, any of your patients, I sell this for $5.99. So they can take all the fat out of my body if they want to. I'm giving it up.
Hey, Dr. D, it seems like much of your job is managing expectations. Just wondering, like, what's the toughest job you've had to do in that regard? Just telling somebody or being honest with somebody with regard to what to expect or what kind of outcome to expect.
Right. I would say that how it's when you tell them the truth and you tell them that their expectation may not be the way they envision it. I think most women do understand it once you tell them that. Most women and it's how you say it, and they know that how coming to us, they're going to get that. We're not just going to take, if we can't help them, we're going to let them know we can't help you at this point. And this is some alternatives. And they usually respect that. I think what's the problem is when they are misled and think that, their expectation can be done, and then they don't get that, then I think that's where the problem is.
Doctor, let me ask you this. I always think that we could possibly, where we're headed with younger people, be in for there could be some damage going forward with younger people as they see themselves. And are you seeing, because of all the social media, because of videos, because of the things that they see in the body shaping and the body shaming and all those things coupled together, that we could ultimately start to have maybe like a deleterious effect on the future, because people just think, all right, if I don't like the way I look, I'll just go ahead and just change who I am. And sometimes that may be psychological, or that just may be internal. Do you think there could be a damaging effect on younger people as plastic surgery becomes more prevalent?
Yes, I do. I do think that. And most women want to enhance it, not totally change it. You do have the women that do want to change it. And that is where you have to, I think the surgeons have to draw that line and explain them that, because you can't change your body frame. Your body frame is your body frame. You can't change that. And I think if the surgeon is very straightforward with them, they'll understand that. What you find is that how one person may tell them that, then they jump to the next person, and they jump to the next person until they find that person that's going to do what they want to do. And that's where it gets tricky. And that's where you get into problems. And that's where you see that sometimes you hear a young lady have passed away, but you don't know the whole story behind that death. You don't know what was said and how, what information did that young lady withheld and not disclose.
Yeah.
So, and I think that's where the overseas get that, because up here, our records, you can get a little bit, you can get more information. You can search more about that patient. But when they go on overseas, that doctor's seeing that patient for the first time and don't know any history on them. So it's basically is what they give to the doctor. They're basing on doing the surgery.
Yeah, I'm reminded of Dr. West, Kanye West's mother, when you say that, and it just sparks up the memories. And every time I go to the doctor, if you change the doctor, they always want to get your old, your old medical records. And I'm just wondering how difficult that must have been for her, because I know she was doing, I think she was doing what you were saying, like, kind of like shopping around and bouncing around, and then maybe she couldn't get that, the new clinic, maybe they couldn't get her information, from the States. So I'm wondering how much of that played a part in what she did,
And you're only doing yourself harm by that, because you remember you're thinking you're achieving what you want, but in the meantime, you're risking your life with that, because now that doctor who's going to do that surgery do not have all the information that they need in order to be able to intervene when there's a problem. And that's why I say it's also, you have to do your research on the doctor. You have to also the doctor has to do their research on the patient.
Yeah. Dr. B, what's the average age range of your clients that come to see you?
I want to say between 20s and 50s.
20s, as high as 50. Okay.
Yeah, as high as 50s.
Okay.
Oh, you got some older ladies out there getting it right.
Yeah.
Maybe in the club doing a little two-step tonight.
Getting things lifted up.
It's Botox, it's IV drip. So there's a lot of other services that we offer. So not necessarily the person is having surgery or doing anything surgical. They're coming in just to maintain wellness.
Is there a good time for a woman to, let's say, have a tummy tuck or some sort of, relative to maybe another time? Is there a good time if let's say it's something that she's thinking of doing or considering? Is there a better time to do it?
I say it's the time that you feel that you're ready and you're doing it for yourself. As long as you're, don't base on your on you doing this to look like someone else. Do it based on if you're ready. What you want to see. If you're, you're ready. This is, you've had your children. You want to take care of you, or you want to get a jump start of your fitness goals, because a lot of people, because remember, once you have the surgery is not it. Just having the surgery and that's it, and then you continue going back. Because that's a lot of trauma to your body. So you don't want to just keep on just having surgery. Surgery is not lifestyle. It's not just just to maintain yourself. That's not the way. Surgery is to accelerate it, but you have to maintain as far as healthy eating and exercising, and also your body. You gotta, because you keep on doing that surgery to your body. You're gonna look small, but your skin laxity is gonna be very loose, and you're not gonna be happy.
Yeah.
Yeah.
We have a question.
We got a question from Marsha.
Yeah. She wants to know what did you have done and how did it change your life?
How did I figure that someone was going to ask that? So I have 3 kids. After my 3 kids, before I turned 40, I wanted to be able to have a tummy tuck, and because with everything, age and everything. So I had my tummy tuck done. I had it overseas, and it was something for me. I wanted to be able to, when I looked in the mirror, that I was happy with what I seen. And although my husband was very much against it, but it was about me. It was for me, and I'm very happy that I did. And if I had to do it again, I'd do it again. If I had, because I'm very happy with the person that I see in the mirror.
So, Dr. B, let me ask you a question. So, if somebody has like one of the bypass surgeries or something like that, and they have like will they get a tummy tuck after that? Because that now they lost so much weight and they have everything like that. They will get one in the arms and all that stuff. Okay. And probably the $1 million question a lot of people probably want to know is, how much does some of this stuff cost? What's the price range, and how can people pay for it? And is it payment plans, credit, or insurance and stuff like that? I'm just saying, we got certain kind of folks watching. Is it a GoFundMe?
Can you put it on? Can you put it on layaway?
Yes, you can. You can by saving it up until you got your money's right and go and have the surgery. So it all depends. It all depends where you're having it, who's the doctor. Obviously, if you're doing it here, it's going to cost you more. That's just the way it is. It's going to cost you more if you're doing it here. If you're going overseas, it's going to be cheaper, but not, you also got to factor the fact that you're traveling, you're staying over there, you have to stay in a recovery house. So it all adds up.
Mm-hmm. Yeah. So you might wind up paying over there what you would pay here by the time you pay for the stays and travel and everything. You think is it that much of a statement, or does it come out to about the same?
Probably not, but then you also gotta factor, like I said, you gotta factor of not just the surgery, you gotta factor as far as your post-op care. And I think sometimes some ladies don't understand that. They don't budget for that.
Well, let me ask you this one question I've always been curious about. When someone gets something, let's say it's a breast enhancement or or the glutamus maximus enhancement or whatever, does it feel natural or does it feel synthetic?
I can speak on that.
Oh, from what perspective?
Long time ago, I used to be in the strip clubs. Bad, Dr. B, bad. I was a bad man back then.
Okay. So all right. So two-part question: how does it feel to the person itself, and then the person that I guess is, I guess, in a relationship with them? So does someone lose sensitivity on certain parts of their body, or
It all depends. Sometimes you do. As far as if, sometimes it's not guaranteed. So if you have breast enhancement, it's not breast augmentation. It's not guaranteed that you're going to have the sensation. Sometimes some people do lose it. But as far as it varies with everybody, and it varies with the skills of the doctor. I mean, sometimes you can see a woman naked, you'll never knew that she had surgery. It's all the matter of the skill of the doctor, the individual, how they heal. It all depends on how how their body responds to the surgery.
how long does it last? Like, because we used to always joke to say if someone has breast augmentation and then they're 80 years old and the breast has not moved or something, like, how does it? Is that another thing that just depends on the person?
Well, now these days, before when they were doing the saline implants, they were saying 10 years. Now you have different kind of implants technologies. So now it's it all depends on how, what they use, how the person take care of their body. But more or less to say is if someone had a tummy tuck, it's going to last if you maintain your wellness goal and you exercise and you eat healthy. But if you go back to the same, as before, you're going to go back, you're going to gain the weight.
So it's not a magic elixir. You have to do your part.
You have to do your part.
Yeah.
So a question came up.
We got a question from Max. Yeah, Max.
Okay, go ahead, Rob.
Now, Max John Batiste got a question. They want to know, are men having surgeries, and if they are, what is the main surgery that men have?
Men are having surgery. They're having abdominal etching. They're having liposuction. So that is something that you start seeing because, again, looking at Instagram and want to be buff, and there's ways of now accelerating and getting to that. So yes, you can see that.
Yeah.
Okay.
So we saw Funkmaster Flex get his done. So hopefully him as a celebrity and his known won't make it such a taboo for people like trying to get the ultimate goal. So hope
correct, and it shouldn't be. Because guess what? This has been going on for many years. We're just getting on it now, or and some people are just afraid of talking about it. But it's not. It shouldn't be. It's, if this is what you want, go for it. Why not?
Doc, I want to go back to something like this, the pee injection, right? Real quick. So what's the difference on the pee injection to the little blue magic pill that that we see in the commercial? So the pee injection, it sounds crazy. The blue pill, they always see white people in tubs about to have sex. So with the pee injection, how does that, how strong is it compared to the little blue pill?
It is well, I'm being told that it's very good.
Did you give it to your husband?
No.
That's a joke.
Has any of your clients had the injections and it got stuck? Like
no, at all. He won't let no needle come close to him. He's like,
oh, okay. No, because the thing is, I don't know if it's like the injection, like you get the injection so then it stays that way. So you just walk around with it all the time, just staying that way?
No. So the P-shot can basically, the injections are done in multiple parts, certain areas in the shaft and also in the
base.
The base. You say?
Okay.
And what it does, it helps.
That sounds painful.
Oh my gosh, I'm screaming.
Not really. We're using diabetic needles, very small insulin needles, very small needles, and it's not painful per se. It's I think it's the anxiety because when of getting it done. But what it does is it helps as far as keeping an erection. It helps
Okay.
as far as getting her erection. And that's what some men are struggling with. And that is the reason why they were on Viagra or on taking medication. And this is more natural because this is them. This is the blood. We're spinning that blood and using that platelet-rich plasma that has growth factors that helps that.
Okay,
Yeah,
so it's not a one-time shot. It's like a recurring thing or something.
Annually,
Like
you can it's annually once a year.
Yeah, I had blood spinning before
And the
my
woman
arm.
does it too, just so you know.
Women.
You say women do it.
Well,
Oh, time. I know producer Jamie trying to get me on time. Explain what women getting. Why they need it for?
They need it for as far as dryness, because as we go in,
Oh.
as we start getting to the menopausal age,
They need it for the juices. They need their juices flowing.
that's right.
Okay. Yeah.
Is it something?
Okay.
One more thing. Is it something called the skinny shot?
No, that's not the skinny shot. The skinny shot is lipotropics. It helps as far it's
No.
based on amino acids and B12 that helps as far as to lose weight.
Okay, I'm getting.
Yeah,
I'm
D.
getting
Men don't want nothing skinny down there. We don't want our things.
No,
Skinny.
no. I know.
Totally different. Totally different.
Totally different.
Now I'm about to be a heroin. I'm about to OD on the skinny shot. I need 1,000 skinny shots. But Dr. B, before we go, anything you want us to touch on? Like, how can people get in touch with you? And how can they how do they reach out to you? Where you're located and all that stuff?
So we're located in Sunset Park. Plasti Muñecas, Forever Juvenis is at 517 53rd Street in Sunset Park. We're expanding. So we have a lot to offer in the next couple of months. So we do laser, we do IVs, we do body contouring, post-op. So there's a lot of services that we offer. And more importantly, we're not, we're here to take that journey, and we know it because we have done it ourselves. And that's very important as far as being able to share, because some of the ladies that are thinking of doing it or that have done it, they're afraid. So we from experience, we can share our experience of what to expect.
Wow.
Doc B, I'll tell you one thing. You're going to have more black men lined up for the P shot than the COVID-19 shot.
Oh man!
You have a line going around the corner for the P shot. They're gonna say, I'll catch COVID. I'll get the COVID. I don't care about the virus. Give me that P shot.
Yeah.
Right.
Some people might get in line twice. So, Dr. B, thank you so much for coming on today. You was a great guest today. Thank you for informing the people. Thank you to put it real simple so people can get it. We truly appreciate you. We love you, Doc B. And hope to see you soon when COVID ends in person. Again.
Thank you so much. Thank you, guys.
Thank you. Have a great night. Thank you.
All right.
Bye-bye.
All right.